our use of Arbrea, the Arbrea breast app, has evolved over time. Again, we've had it for about 3 years, and so the way we use it today is different than we initially used it, for the better. I think we've come to understand how we can be more efficient for the patient's time and our time. And so current practice is the medical assistant will bring the patient in, kind of do their intake form, review their health history and history details, and then they get preoperative photos. So our pre-op photos and photos for the Arbrea app are taken prior to me seeing them. Then once all that's complete, I come in and I visit with the patient, get an understanding verbally of what their goals are, and explain kind of details of surgery and all of those things. And then knowing what their goals are, I do an exam. So I know where they're starting from and I know where they want to end up. And then the Arbrea really links that. It takes us from where we're starting to what they've described as their goal. And so that's the point where we'll bring Arbrea in, and I can bring it up right in the room, show them on the screen, here's what I'm interpreting your goals are. And then they have the opportunity to say, yeah, I like that, or can you show me a little bit bigger, or can you show me a little bit more natural, and we can make adjustments right there in the real time. The Arbrea app, I really think, has revolutionized how we can help patients understand the complexity of their situation. Some patients have congenital abnormalities or asymmetries. Some patients just have really challenging aesthetic cases. And to say, well, this is going to be better, that's going to be better, that may or may not be helpful. They don't really understand what I might envision that result being. With Arbrea, we can show them. So I can point out, look, this inframammary fold is this much different, or this nipple height position, or this one has this much more volume. And some of the skeletal rib structure things that are going to affect our aesthetic outcome, I can say, here's what I think is realistic. And Arbrea can show that to them. So they can see that before and say, yeah, I guess I'm still going to be a little bit off this way, or I guess I'm going to fix that to this degree. But it may not be perfect because of the ribs or the spine or whatever. And so I think it's helpful from a plastic surgeon's perspective because we can show them some of those things to give a realistic expectation. And I think it's helpful for patients. They have a realistic expectation to say, okay, it is a complex scenario, and here's the improvements that I can anticipate. So the incorporation of the Arbrea app in our consultation has made it quite seamless. So typically, the medical assistant will bring the patient back to a consult room. She'll do the intake review and history and basically get an understanding what her goals are. We also have the patient change into a robe. She'll get the photos, the preoperative photos, and we'll also at that time take the photos for Arbrea. So we have kind of our pre and post photos available, but also we have the ones we can use for Arbrea at that time. Then I will meet with the MA. She'll kind of get me up to date on that history, and then we'll both enter the room together. We will discuss with the patient their goals again, make sure we're on the same page. We'll do a physical exam, and at that point, we're ready to use Arbrea. So that's pretty short and pretty streamlined, so we can get the patient to that point where we're looking at goals and what their outcomes are going to be pretty quick. So we use Arbrea live with them. They're looking at the large display in the room, and I'm using the app, and we're making the adjustments of different implants. If we need to do a lift or a reduction, we can make all those adjustments. And they're seeing that as I'm seeing it real time. We give them, typically, they'll want to choose between one or two options that they've looked at. Once we know that, we have our plan. The girls are ready to give that quote because it's got that established. I'll finish up a discussion on recovery and how we'll hold the hand through that process, what the risks of the operation are, all the things that we need to talk about, and answer their questions. Once they're done, I will hand them off to the MA. She will introduce them to the patient coordinator, who will give them a printed quote that's already ready and answer any questions, resolve any issues from there, get them scheduled. That's it.